Good evening and welcome to the Policy Subcommittee meeting of the Brockton School Committee, Tuesday, January 19th of 2021. Due to the ongoing COVID-19 pandemic and state of emergency, on March 12th, 2020, Governor Baker issued an executive order temporarily suspending certain provisions of the open meeting law, GL Chapter 30A, Section 20. Pursuant to that order, public bodies are temporarily relieved from the open meeting law's requirements that meetings be held in public places, open and physically accessible to the public, so long as measures are taken to ensure public access to the body's deliberations through adequate alternative means. This meeting will be held and will be accessible to the public via Brockton Community Access, Brockton Public Schools website, www.bpsma.org, YouTube, and Comcast Channel 12. The public can access this meeting via the following link, www.youtube.com/TheBrocktonChannels. All right, so this evening's agenda, we have 5 items on the agenda. The first, we'll have an update from Dr. Richard Herman. Many of you probably been watching our meetings know he's a pandemic consultant that has been working with the city since the beginning of COVID-19. The second item is the hybrid return date discussion. Third would be the cohorts. Fourth, modification to electronic device policy in the student handbook. And then the last item 5, any other business that needs to come before the policy subcommittee. So the first one more thing I need to do before we give the floor to Dr. Herman. I need to do a roll call of the school committee to establish a quorum. Mayor Sullivan.
Here.
Okay, Vice Chair is here. Ms. Asak.
Here.
Mrs. Mendez.
Here.
Mr. Minicello.
Here.
Mr. Rodriguez.
Here.
Mrs. Sullivan.
Yes.
Mr. Sullivan.
Here.
Okay, we have a quorum. Dr. Herman, the floor is yours.
Thank you. Thanks very much for inviting me again. We'll go through the same drill that we've gone through in the past and bring you up to speed on where we stand as of pandemic day 312 back since March 14th of last year. So when I last spoke with you 2 weeks ago, there had been nationwide 350,000 total deaths. And as of today, we have broken the 400,000 mark, which is not a milestone anyone wants to really achieve. Here in Massachusetts, this is just a look back over the last 7 days. The deeper the color of the state, the more densely populated the COVID patients are. In Massachusetts, we're at 74.8. The red, yellow, green number is 74.8 over the past 7 days, meaning about 75 new cases a day per 100,000. Just to refresh, this is where we were at the end of the year, just updated with kind of, I think the number count is pretty accurate at this point. All the cases, all the test results are back. So through the end of last year, a total of 8848 cases through calendar year 2020. And this is what the March of COVID looks like in the city. You can see that after Thanksgiving, there was a huge spike, and then things plateaued a bit. And then after Christmas, another huge spike. And now things look like they are plateauing a bit. Of course, there's other players in the mix we'll talk about in a little bit to kind of figure out which way things are going. This is where we were 2 weeks ago at about 9,000 cases with 348 deaths and a red, yellow, green number of 72. And this is our dashboard today. So we've topped the 10,000 case mark. We've added a death toll over the last few weeks, so we're up to 358. Thing that concerns me quite a bit is the hospital census. And I can tell you just by working a shift in the ER this weekend, there is COVID everywhere. And both hospitals are feeling the pinch. It has been 8 months, mid-May, since the combined hospital census broke 100. And so we're really in a place where we don't want to be in terms of the hospitals. Of course, it peaked at over 200, so there is capacity, but still we want to make sure that we have hospital beds available to take care of us if we get sick. And as you can see, our red, yellow, green number continues to go up. And just you're all familiar with the red number being greater than 10 cases per day, but I keep it just because I distribute these this slide deck, and it's a good reference slide to have. This is what our neighbors are doing. So we are not alone in our misery. Everybody who touches us is in the red, as it were, with pretty high case counts per day. The numbers for the most part went up last week over the preceding week. Here's what I mentioned in terms of hospitalizations. This is the history since mid-April of the combined census in the hospitals. Each bar is a day. And you can see we're kind of hovering in the 90 cases per day, breaking 100 today. And as I pointed out in the past, anything over 50, which is 15% of the hospital beds occupied by COVID patients, is a warning sign that hospitals are in jeopardy of being overwhelmed. Death toll has not peaked like it did early in the pandemic, but certainly seen a lot more deaths in recent weeks than we had over the summer. And this is the age group of those that have died. As we've mentioned many times in the past, it is not killing young people. So this is under age 30, no one in the city has died, and very few under age 50 have died. This is the Brockton Neighborhood Health Center shared their percentage positivity. I like to use their percentage positivity only because it's more up to date than we get from the state. This is right through this weekend and kind of has remained sort of in the ballpark of 20% over the last several months, 15 to 20% positivity rate of Brockton residents tested. Again, this is what our red, yellow, green number has been doing over the past many months. It will be released on Thursday, and with so much volatility, it's difficult to predict, but my guess it'll be around the mid 90s, around 94. It's going to continue to go up, but I think it will level off in weeks to come, unless other forces take hold, as we'll talk about. This is a breakdown of all the cases of COVID since March, since the beginning of the pandemic, pretty evenly spread out across the middle decades. And this is what our contact tracing program looks like. So each week, as I've mentioned, we've had a call with the CTC, the Community Tracing Collaborative, who the state partners with to do the bulk of contact tracing in the city of Brockton. And this is a week's worth of cases from the 7th to the 13th. And I'm not going into any of the details as in the past. It's really meant to show kind of how they break down cases in terms of clusters, no clusters, household contacts, close contacts. They look at workplaces and break it down by the type of workplaces. They look at congregate settings and break it down by the type of congregate settings. And the take-home message, again, is it's everywhere. It's in the households, it's in your household, it's in your close contacts, it's your friends, your relatives who have COVID, even if they appear totally asymptomatic, as now we know pretty certainly that 50% or more of all COVID is spread by people who have absolutely no symptoms. And to kind of give you, and this is not an official slide from the CTC, but I did ask them to kind of put together a slide that in a pie chart that makes it a little bit easier to see where all the cases do come from. And this is from about November on to the present, or at least until last week. And the idea here is that most people get COVID from someone else in their household that has COVID, or from a close contact that has COVID. The rest is work and school and church and other places, restaurants and health clubs and whatnot. But the vast majority is people that you know. So people that you live with, people that you come in close contact with. And that's how COVID is spreading for the most part in our community and in the vast majority of communities across the country. So what about the kids? This is where we were 2 weeks ago. We had 785 kids up until that point in Brockton. We are now at 975. So over the past 2 weeks, an additional 190 cases, no additional hospitalizations, although I did see that an 18-year-old was hospitalized last week. No ICU patients and no deaths in anyone under the age of 18. So again, just breaking it down by month, and obviously this is a little over half a month of January. So my guess is January will be pretty close to December in terms of the number of kids with COVID in January. And this is just a little different look at it if we break it down by week rather than by month, just to kind of give you a idea of the trajectory of which direction things are headed right now. My sense is it may flatten out after this week, but still this is part of the post-holiday surge that we're seeing. Again, breakdown by year, just to see we kind of, other than infants, sort of increases as kids get older. This is adding the 18 through 21-year-olds, as I know there are some in the system still, but just to kind of show you that it kind of gradually increases with age. And this is a breakdown by school age. So again, pre-K, elementary school, middle school, high school age kids. And this is from the beginning, total number of students or children, I should say, that have COVID by age group. As you probably have heard, this is the actual first Moderna vaccine that was given to first responders. So police, fire, EMS got vaccinated last week, and what I would consider to be a very successful program in some regards. Successful in the sense that it came off without a hitch, and no dose was wasted. I would criticize it in one regard, in that I was somewhat disappointed in the percentage of people that got vaccinated. I was sort of hoping for something closer to 80 or 90% rather than the 60% or so that we vaccinated. But I was told that if community leaders are shown getting vaccines, and here's your chief of police getting his, that maybe others would follow suit. So I'm going to use that tactic, and hopefully others will see that it's okay to get a shot. Here's my concern. This is published in the Journal of the American Medical Association. Early in the pandemic, 75% of folks said, I'm going to get that shot as soon as it comes out. However, in recent months, that number is really in the 50 to 60% group. And that is playing itself out in your city as the hospitals, both hospitals and neighborhood health center, have pretty much completed all of their vaccinations, with totals around 55% of healthcare workers getting vaccinated. Again, not the way to stop the pandemic by summertime. This is not the most effective strategy. We want to get closer to 80 or 90% vaccinated. I did want to touch on, there are 2 vaccines that are approved, but there's another one around the corner, probably in February. It's a little bit different than the other 2 vaccines that have already received emergency use authorization. This is the Johnson & Johnson vaccine. It's not a messenger RNA vaccine. What it is they take a little bit of genetic material out of the coronavirus and they stick it inside a common cold virus, adenovirus, and then they inject you with the adenovirus and let the genetic material make proteins so that you can make antibodies. Again, you cannot get COVID from this vaccine, but the reason it's good to keep an eye on this is 2 things. 1, single dose, so you won't need a second dose. And 2, it's good to stay in the fridge for 3 months, unlike the current vaccines that we're using, where everyone is kind of thawing them and monitoring and watching the temperature and watching the clock and making sure that 6 hours isn't up before you give the dose. So this is around the corner. I know this is a busy spaghetti slide, but the point here is this is flu season. And all of these colors here are past flu seasons over the past decade. These triangles down here are where we are now, with the dotted line being kind of a baseline of where flu would normally be, just the amount of flu in the background. So we are under the background levels of flu, hardly any flu. I haven't seen a case myself in the ER, but there's some out there, but not much. It's true, it could go up later in the season, but my guess is that if we mimic Australia, who has been through their flu season already, that my guess is that we are not going to have much of a flu season. And as you know, the Commonwealth has kind of done away with the mandatory flu vaccines for kids and college students, and probably the behaviors that we all use just in terms of social distancing and mask wearing and kind of being aware of the people who have coughs and colds around us and heading for another zip code if we get close to them is probably preventing the flu from spreading as well. Another thing, and these, by the way, these are just recent articles published by CDC in reputable journals. This is, again, the Journal of the American Medical Association. The numbers are not so important. The takeaway message here is that mathematical modeling is all over the place. And this is one that was published in a very reputable journal, in the Journal of the American Medical Association, which basically says, even though there's 10 million plus reported cases, probably it's closer to 47 million cases. So if we extrapolate that to Brockton, where we have 10,000 cases now, then it's possible that we've had 40 or 50,000 cases in the city, just based on the modeling, based on the fact that very few people were tested early on, and that so many asymptomatic people or minimally symptomatic people never get tested. And I just wanted to touch on, in the news, you've probably heard about the SARS-CoV-2 B117 lineage, also known as the UK Super Ninja COVID strain. They don't really call that. They call it the B117 variant of concern. And the variant of concern is maybe a phrase that you might hear because there's several of them out there. The UK strain right now is getting a lot of press, but there's probably 3 others that are gonna get some press as well. This is a sort of a cartoon of what the strain looks like. On the right-hand side is the coronavirus. And the way the coronavirus gets you is its little spiky proteins latches onto your cells, and it fits in kind of like a jigsaw puzzle. But the coronavirus is not so good at latching on, believe it or not. It's kind of like close, but not quite a good fit. This B117, the variant of concern, the UK strain, has a whole bunch of mutations in its genetic material. And what that does is it causes the spike protein to change its shape just a little bit so it fits in the puzzle piece much, much better. And that is why it is so much more infectious and contagious than the standard coronavirus. And the CDC has now started tracking it. I can't believe it. There's only 122 cases with only one documented in Massachusetts. We don't do a great job of surveillance like other countries do, but I think they feel that this has the potential to go out of control just because cases are surging around the country. And if this virus spreads many times more quickly than your standard coronavirus, then there's a concern that by over the next several months, and talking about February and March, that this strain of virus could take over. And what's the concerns about these variants of concern? The concerns are that it might be able to spread more quickly. And in red, the red is what we know about the current UK strain, that it does spread more quickly. We're worried that it might cause more severe disease. That does not appear to be the case with this new variant, but with more cases yet to come, there will be more hospitalizations and more deaths. So it may seem like it's more severe, but the actual severity of illness is about the same as with the standard variant. There is a concern that any new variant may avoid, not avid, avoid, sorry, spell check, to avoid routine testing. And that is in fact the case with some tests that can't pick up this variant. Now, in the UK, they kind of run 3 tests, and they know that if 2 of them are positive and 1 is negative, they got that strain. But this is a concern with other new strains that might appear, is that they might test negative and not be detected by routine testing. And likewise, there's also a concern that they may be resistant to either treatment or vaccination. That does not appear to be the case. Most experts believe that the current UK variant of concern will be able to be treated, will be susceptible to the monoclonal antibody treatment, and will infection will be prevented by the vaccine. So that is my update, and be happy to answer any questions if you have them.
Well, first, thank you again for coming and preparing this information for us. We know it, takes a considerable amount of time and effort on your part, and we really appreciate it. It helps us try to figure out the right decisions to make for the district and for our kids. I know I had 2 things that came to mind, and then I certainly want to give the members of the committee an opportunity to ask any questions too. But are they aware of any side effects so far of the newer Johnson & Johnson vaccine? I know there've been some limited cases with the other ones.
I'm not aware of anything that's currently stopped it's still the phase 3 trial is still ongoing, and they're not going to be reporting their data until, I believe, the end of this month. And so I'm not aware of anything that has stopped the trial from proceeding.
Okay. All right.
At least currently, I think it's all in process still right now.
Right. I was just curious, they're putting it in a cold virus. Did you end up feeling, did you end up getting a cold or?
So this is a very, very common way to prepare vaccines. And many of the current coronavirus vaccines that are being developed around the world use this viral vector. So you stick a bit of genetic material inside a virus, and off you go, and cure Ebola and things like that. So it's been used in the past and is very effective. And usually you don't get sick. The virus itself has been engineered not to cause illness, but just to sort of inject that genetic material into cells and not invoke a huge inflammatory response to cause illness.
And I know that I'm not the only one that's heard some people say it doesn't affect kids. Look at the numbers. There's a low amount of kids being affected by this. What would you, to the folks that say that to us?
Yeah, well, it is true that you look at the numbers, and the percentage of the population is not as often in kids, but kids do get affected. My concern, having a college-age kid who's at a college who has lots of COVID going around, my concern is that we're, not quite a year into this pandemic, and there is some, and we don't know. We don't know what long-term consequences are of COVID. I know that, sort of the Facebook buzz is just get COVID and get it over with and I'm good. But the medical journal buzz is, let's do neurocognitive testing on these folks at 3 months and see how their memory is impaired and their judgment is impaired and other things are impaired. And we do see, even though it's small numbers and only a 3-month time frame, that there is some effects. And so I'd rather not get COVID and not run the risk of being a long hauler or have neurocognitive deficits and then get COVID. But it is true that kids do seem not only not get it as much, but also not spread it as much. We're getting COVID in our households and from people we know. That's how we're getting COVID. We're getting it from the people that live with us and the people we hang out with, even though we think they're not sick.
Okay. I know I see a hand from Mrs. Mendez.
Yeah, so you mentioned that kids of 0 to about less than 18 years, that has increased by 190 since the last time you presented to us. Is there a reason why this is happening? Is this because of the new strain of COVID-19 or?
No, I don't think so. I think it's just, we've had a huge influx. Don't forget, we sort of gone up by, 1,000 cases in the last couple of weeks. So I think that just reflects the percentage of that 1,000 cases. We're kind of at 8,088, I don't know, but maybe 9,000 cases last time I talked. Now we're at 10,000 plus cases. So it's just those first 2 decades of life represent that amount of those cases.
And then my second question is about the vaccine. You said about when it was first talked about among the health professionals, it was about 80%, I think it was.
So, yeah, so this wasn't health professionals. What this was sort of like just a general population. So they've, kind of done the survey over time and asked the question, how likely are you to take this vaccine? And back in April, it was up kind of in the 75% range of folks said that they were likely to take the vaccine. But at the end of calendar year 2020, as they kind of kept asking the question as the vaccine approached readiness, the number really dropped to the kind of 50 to 55% range, 50 to 60% range.
And is there a reason why you think that has dropped, the interest?
The social reasons, political reasons, so many factors enter into it. And I haven't seen the study that's actually asked the question, but I think you'd have to pose the questions, does your political affiliation affect whether you want a vaccine? Does your educational status affect whether you want to get the vaccine? Are you concerned about how quickly the vaccine was developed? Are you concerned about long-term side effects? Do you want to watch other people get it first and then you'll decide? All of these things are things that, I've heard just, being out and about, but I don't have science behind those to verify that. I know there's definitely science regarding political affiliation and public health behavior, so mask wearing and social distancing, that kind of thing. But I'm not sure if that holds true with vaccine hesitancy.
Thank you.
Ms. Asak.
Thank you, Mr. D'Agostino. Actually, Ms. Mendez touched base on a couple of my questions, but Dr. Herman, thank you so much. As always, you do provide a lot of information, and I do know a lot of our families are tuning in this evening to get an update as everyone's just waiting to see what we're going to do as far as our reopening plan. But I did have one question as far as the positive numbers, the 190 of our Brockton kids. Hold on one second. I took a screenshot of that. So there was an additional 190 Brockton kids added to that 975. Do we have a breakdown of the ages? I mean, is it a cluster? I mean, is it a certain group of kids? What caused that 190 positive cases?
Yeah, I mean, so it's a good question. I have not delved into it that deeply for a couple of reasons. One is I'm not sure how to get the information. It's the public health information that's available through the Massachusetts Virtual Epidemiologic Network, doesn't necessarily give you the answer to those questions. We might be able to break it down by address and link it to school system. We could certainly find out how many of them are part of clusters, but I did not dive that deeply. It's a little challenging to do that just because of the difficulty in getting that information. It could be done, but I think that one of the reasons I showed that breakdown of the contact tracing tree is to just show you that I have no reason to doubt that kids are any different than the other folks, just in terms of the vast majority of everybody is getting it from household contacts and personal contacts. So I would, I'm just assuming, I'm not certain of it, but it seems intuitive that kids are getting it from other people in their household and from people they hang out with.
Okay. I mean, I do admit in the past couple of weeks, the number of people that I'm aware of that have tested positive just skyrocketed, which was very concerning to me. The only other thing is it would help us as a school committee to know where these numbers are with our students. I think that would better assist us as far as our reopening plan to understand what's causing that. And again, the contact tracing is only as good as those that are providing the information. And I'm finding a lot of people are not providing the information for the contact tracing. A lot of people are just brushing this off as like, oh, it's COVID. We've dealt with this for a few months. I mean, I went to believe it or not, I went to a public place. They had a list, sign in for the contact tracing. There had to have been about 21 people, and I was one of 3 people that signed into that place. And that was concerning because I looked around going, there's 21 people here, and only 3 of us signed in. So I think our numbers would I think we'd have more contact connections. I just don't think people are providing the information. So I don't want to put you on the spot, but I'm seeing a lot of people are putting their guard down, especially these days, and our numbers are getting up there, which is definitely concerning. Sorry.
Well,
and
yeah.
No, but again, I always appreciate all the information you provide us. It's just, this isn't going anywhere anytime soon.
Well, I see 3 forces working here that are going to determine the trajectory of where COVID goes. One is vaccine acceptance. So people have got to agree to get it, and then it's got to get rolled out. So we've got a struggle just in terms of where the heck is it? I mean, I'm sure there are people on this call that would love to have a vaccine tomorrow morning if it were available, but where is it? So getting the vaccine to folks, and then educating folks so that they'll take it, so that we can achieve herd immunity and get lots of vaccine into folks. So vaccine is one thing. I think personal behavior is another thing. So as people continue to do all of the things that we are advising them not to do, then COVID will continue to spread. It's out there in a huge way right now. You're seeing 90 cases a day in Brockton. So almost, if you've come in contact with 10 people, someone is, you've come in contact with someone that's had COVID. And so the message is we need to behave ourselves in terms of not being within close contact of other people, especially if we're not wearing a mask. Otherwise, it's just going to continue to spread. So the amount of our failure to follow public health guidelines will be another force. And then the third force is this new variant, which scares me quite a bit, even though it's not out there yet. But it just seems to spread like wildfire in the countries where it has, like in the UK. And if that takes over, then I think we're just going to see one more surge over February and March as the numbers continue to climb. It doesn't have to be that way. We can definitely change it around with changing our behaviors and by getting vaccinated. But, you know, it all depends on how optimistic you are about folks changing their behaviors and how readily we can get the vaccine distributed and into arms.
Thank you. My last question is I do know there's a lot of frustration as far as people trying to go to the testing sites, and they're either getting turned away or the testing sites, they're just not able to get appointments. Do we know, maybe the mayor can step in, do we know, are they going to give Brockton any, especially where our numbers are extremely high, are they going to help Brockton out with more testing sites? Especially if we do go back to school, we're going to need our students and our families to be able to have access to that on a regular basis, rather than wait 3 hours at Massasoit to get a test. So again, I don't mean to put people on the spot, but it's just, that's the biggest concern I'm hearing.
Yeah, I mean, I have the same concern, Ms. Azek. I mean, I'll give you an example. If you went to Massasoit today, you couldn't get tested because the state, Massasoit and Fallon, couldn't agree to continue there. So without even telling the city, without telling me or Rick or the Board of Health, they closed up shop right there. So we have to try to find a different location. It was a state stop the spread facility on state land, which was Massasoit, by a state agent, Fallon. I've been working, Rick's been working, Eno Montesur, Linda Cahill, to try to get more testing. And it makes absolutely no common sense to not increase testing in municipalities that are being ravaged by COVID. So we do have one stop the spread right now currently with the Brockton Neighborhood Health Center. And, you know, we can call ahead. You have to call ahead. And again, they're utilizing both facilities, Legion Parkway, as well as the trailers at the Shaw Center. So, you know, I'll be on a call on Tuesday with the state delegation, again, the 3 reps and the senator, to see if they can help as well. And I feel the same way you do, Joyce. It makes absolutely no sense where communities such as Brockton and Chelsea and Lawrence and the places that have been ravaged don't have more testing capability, but that's just the way it is right now. And again, the state is driving who gets the vaccinations. We don't have any more vaccines to give out right now. I know a lot of senior citizen elders, a lot of teachers have been calling my office. Teachers are at the bottom of phase 2 under the state currently. So we need to continue to be diligent and vigilant, and also spread the word. I mean, Dr. Herman and I are on a call once a week with all the pastors to try to educate and market the really strong desire to get maximum percentage of people to get the shot. When I'm allowed to get it, I'm not in the phase yet, but when I'm allowed to get it, I'm not going to hesitate to roll up my sleeve. So, you know, we gotta have to continue to be diligent with the state because we need more help from the state.
Thank you so much. Actually, I wasn't even aware of the Massasoit Center. I knew they were closed for a few days, but no one knew why. So that's a huge concern because they served hundreds of tests on a daily basis when they were open. So we definitely need to, I mean, if you need us, whatever we need to do as far as advocating for Brockton with our state legislature, and we need more testing. We need another large testing site as soon as possible. That's definitely concerning, but thank you so much for the update, Mayor. Thank you, Dr. Herman. We appreciate all your help. Thank you.
Thank you, Joyce. Mrs. Sullivan's been patiently waiting. The floor is yours.
Hello. Thank you, Mr. D'Agostino and Dr. Herman. I just wanted to ask Dr. Herman, on the slide that you showed with the towns and how numbers of them being in the red, there are other towns that are higher than us, right?
Yes.
Okay.
Yes, we have, Mayor and I have a call monthly with our surrounding towns, the towns that touch Brockton and a few others, and also a call with the Plymouth County towns and kind of go over their numbers. These are publicly available numbers. You got to do a little diving through the raw data of the website to get it, but it's out there. You can follow the numbers every week, and I like to, I get it that Brockton doesn't live in a vacuum, where COVID doesn't respect municipal borders. So I like to show kind of the bubble that we live in is not just a bubble. It's surrounded by lots of other bubbles.
Thank you. I thought that slide there is really interesting. Thank you.
All right, that's it. Any, are you good, Judy?
Yeah, I'm all done.
All right. Any other members of the committee have any questions for the doctor? All right. Well, again, thank you so much for the prep time that I know goes into getting ready for our meetings, and certainly for your time tonight in the Q&A. We really appreciate everything that you've done to help the city and help this body make its decisions.
My pleasure. Thanks. Be happy to come back again.
Thank you. All right. Well, with that, I think we can move to item number 2 on the agenda, which is the hybrid return dates. Superintendent Thomas, did you want to?
So right now we have the dates of February 2nd, which was the date to return our students with disabilities. And it would be February 8th would be the date that we were going to return, the 9th, which is a Tuesday because Monday is going to stay remote. The 9th would have been pre-K, would be pre-K and K, 6th grade, and also the 9th graders. And then there's the week of the vacation, which is the week of the 15th. And then the other grades would start on February 22nd. So that's currently the return dates that we had voted on last time. And again, those are the return dates that we have currently on the books.
All right. I mean, I don't know, maybe we can kind of take a poll and go around with the committee, but given the data that was just presented, the numbers are still climbing. I feel like maybe we should consider another delay, as much as I hate to do it for any number of reasons that we've all talked about and that our constituents have reached out to us about, especially with our special education population. I know that, this is had a really challenging effect on them and educating them specifically. And, but it's tough to follow the data, have the numbers elevating, and then continue forward. I don't know, I guess, maybe we can, my thought, would be to maybe delay a few more weeks for special ed, and then the general, the rest of, students starting to go back with pre-K, K, 6 and 9, maybe, the beginning of March, but curious to see what the input of the committee is. I know I saw Miss Asak. Did you have a hand up?
I did. I wasn't sure if you were going to go pretty much just go from one school committee member to another.
Yeah, well,
So
you know what? Maybe I can do that. I'll just go ward by ward. Yeah, I'll start. Mr. Minicello, I'll just go 1 through 7. Mr.
Okay.
Minicello, do you want to comment or? No. Okay. Cynthia, did you have any thoughts on this?
Yes, I would love to comment. So one thing, so you mentioned constituents. I've had a few people reach out, and one of their biggest thing is having a choice. So opening the schools where the parents at least have the choice to send their kids if they can. Yeah, the numbers are up, but I think that's something that we're going to continue to see go up, especially with this new variant. So I do agree that, I myself as an educator, we've had cases, and it's just a matter of being precautious and having protocols in place where it's like, okay, this happened. What's the contact tracing? Okay, you can't be in the building for this amount of time. but these students continue to come, or this cohort, whichever way we decide to do it. But I do think we shouldn't delay it any longer. There's other districts that have opened, they are making it work. And I do think, like, with the knowledge that we continuously have, and just, I think we can make it possible. Because we're starting small. It's not like we're starting big. And I do have a question though. So I know when we start off, we're starting with the high need students. Does that include the homeless and foster students as well? Or is that a different phase? I know that's written in DESI somewhere. So if any
That would be the second phase.
the second. Okay. All right. Thank you. Yeah. So then that too, like if the first phase is the high needs program, we're starting with the most vulnerable population, but I think we could definitely put things in place that can allow it to happen. That's my take on it.
Okay, thank you. Mr. Rodriguez, any thoughts?
We all know the numbers are rising. I mean, we can be fed all the data and numbers, and we just have to make sure that everybody returns safely. I mean, we could see, there's sports activities going on. There's a lot of engagement, but I kind of like stuck right in between. I agree with what Cynthia just said. Let's, can we put something where we can kind of give the parents the option of who would actually send their child to school? What is the actual number? And if we delay this, another 2 weeks or 3 weeks, we're already into March, and what if we get a bigger spike come March? Where do we go from there? So we all see what's going on. I'm in the hospital 90% of the time, and I've seen it, firsthand of what these medical providers are going through, and the people that are suffering from it. And it would be very unfortunate that we have any of our educators or students contract that and be at the bad end of this disease, this virus. So I'm still gathering all the information. It's very hard to dictate, which way where I want to go. Do we want to give it a couple of weeks, or do we want to give the parents the options? And how many parents are actually going to take that risk? We've all been receiving those phone calls and emails of opening up, not opening up, from teachers to the parents. It's across the board. So stop right there.
All right. Mrs. Sullivan?
I agree with Cynthia. I agree that there has to be a start. Parents have a choice. Okay, they've always had the choice. They can do remote or hybrid. I think you let the parents decide, and they've already decided in a lot of the cases. But I think you have to do something, or the whole year is going to be gone. It's almost been a year the kid's been out of school. I'm an advocate. I see it on the inside because I work in a school, and it's very aggressive how they deal with a case. The people are filtered out right away, and it's just unbelievable the way, how much work that everybody from the top, from the superintendent down to, your nurses, your food service, your teachers, your paras, your MTAs, they're just phenomenal in what they do. So, and I know they will be in Brockton too, because our Brockton public is, very good. So I'm with Cynthia on having a starting point somewhere. Yeah, before the end of the year is gone.
Okay. And I didn't want to cut you off. Is that all right?
Yeah,
Mr.
no, I'm
Sullivan?
done.
Sorry, I skipped Miss Asak. Sorry.
It's okay. Thank you, Mr. D'Agostino. It is definitely a difficult decision, and this is not a decision that I'm going to make easy. It's not going to be an easy decision, let's just say. I've been reaching out to constituents. I've had many emails, phone calls, and meetings with a lot of our families in Ward 6, and the majority of them at this moment do not feel comfortable, and they prefer, here's the catch, they would prefer to keep their children remote if the children are able to stay with the teachers, because they've already built somewhat of a rapport with the teacher, and their biggest concern is we choose to keep our children home, we choose to stay remote, but then my child has to start all over again with a new teacher. If there is a way that we could try to figure out some kind of a way for the students to be able to stay with the teachers they currently have, rather than disrupt them halfway through the school year. And the other issue I'm having with going back, as soon as we have a positive case, then the parents have to find childcare. They have to go through the whole process again, where a lot of them having that uncertainty as far as, well, what happens if there's a positive case? Now I need to find childcare for my child, and it could be last minute. So that's another concern as far as parents. Many of them are working, so they need some kind of a stability, knowing this is what our schedule is going to be like, and not, every couple of weeks, my child's going to be home because there's a positive case. So at the moment, I'm putting my families, our teachers, our staff, their safety is priority, and I am not for it at the moment. I think we need to delay just a little longer. Our numbers are really high, and a lot of people are putting their guard down, and it's very concerning because I'm seeing it on a daily basis. I don't think we'll be able to make it within the first week without having to close, because our numbers are going to spike. So I think until we have more people that take the vaccine, it might be a little safer. But right now we have to keep our students, our teachers, our families, our BPS, we have to keep everybody safe. So, and I know we're already into mid to end of January pretty soon. I understand that, but I don't want to see our numbers skyrocket to the point where we can't control it. So safety. Thank you.
Thank you, Mr. Sullivan.
Yes, I agree with Cynthia and Judy and Joyce as well. One thing I wanted to mention, I just found out today, as a couple of you know, I live on a dead-end street. There's only 5 houses. But I found out that COVID-19 is at the last house on the street and the first house on the street. So just my street alone, it's almost 50%. And I'm really shocked at Dr. Herman's graphs. It seems to be getting worse and worse. But I do agree with Cynthia and Judy, we do need a start date. But I would say February 2nd is too early. That's only 2 weeks away. I would suggest that we don't even talk about it till after the February vacation, and maybe bring them back then. See what happens.
Okay.
Thank you.
All right. Can I ask Superintendent Thomas, can you maybe jump in with 2 pieces of information? Because one of the things I definitely heard from the members of the committee as we were going around, and I've heard it from parents too, of course, I think we all have. If I choose to continue to keep my kid remote, even though the district is going into hybrid, what's that look like? Does my kid's teacher change? Is it a live stream into the classroom? What's that going to look like?
Well, it's probably going to be a combination of both, because teachers will have to, if I'm staying hybrid, I'm going to obviously be home a few days a week. And if I'm going to go to school 1 or 2 days a week, and then I'm home 3 days a week, then obviously the teacher that I have would have students in front of them, teaching them, and then students at home. So that would be you're not going to see as much live instruction as you see now, because the teachers have all the students in front of them on the computer. And when a teacher has a group of students in front of them in class, they're not going to be able to spend the whole time with the students at home as well. So you'll see more asynchronous work during for the hybrid model. On top of that, there's about 105 teachers right now, and probably another 40 paraprofessionals and MTAs that do have medical documentation that they would have to stay remote, meaning that the reason we can't 100% guarantee teachers that students will be able to keep their same teacher is that we have to make sure that there's enough staff to cover those classrooms. So if a teacher's staying remote and they're going to live stream into the room, which again everybody is talking about, you still need an adult in the classroom for the students that are they're hybrid, and that's a lot of staff. And we've been looking for staff. We've hired some staff, but there's still probably about 150 people to cover in buildings to make sure that there's a physical adult in the classroom, even if the teacher is streaming in remotely because they're not coming back into school. So there's a lot, and we've worked on all these scenarios. So again, we would do our best to try to have students keep their teacher, but again, it can't be 100% guaranteed because of being able to staff the classrooms with a physical person. So, but again, like Ms. Sullivan says, people do have the option. They've had the option that we have right now about 1,700 students who have signed up to stay full remote if we were to come back hybrid. And that number fluctuates depending on where the numbers are. If we return to school and positivity rate is over 90%, then I think you would see many more students staying fully remote because people are afraid, obviously. And we could see more staff staying fully remote depending on where the numbers are. So that's pretty much the difference between, the hybrid and the student staying fully remote. That for the teachers that are not coming in, and if we do have them live stream, which we are it's still a conversation with the union, we would still have to make sure there's a physical adult in the room with the students who are present.
Right. And I don't mean to go on a soapbox here. What'd be really helpful is if the governor put the teachers further up in the line to get vaccinated, because, we want them to go back into school and be around each other, be around kids, sure help sell that if they were vaccinated, and also might make parents more comfortable too. I mean, we can't get all the kids vaccinated that quickly, but if at least the staff were, it's less exposure. But, I don't know. Why would we want to do that?
You make a good point. There is a chance that, with the change of administration taking place tomorrow, there is talk of the Biden administration putting more vaccines out, making school personnel a priority. So, we could see that change within the next 2 weeks. That it could, school personnel could be made a higher priority across the country with the change in the administration. We'll have to wait and see how that plays out over the next 2 weeks. But that's the talk around other superintendents as well.
Yeah, that'd be helpful. Mayor Sullivan, I wanted to give you a chance if you wanted to jump in.
Yeah, I mean, just for the members of the committee, myself and the vice chairman and the superintendent had a very in-depth conversation today as well about what some of the other gateway communities and some other municipalities are doing. Again, our job is to make sure that the environment is safe for the boys and girls and for the staff and teachers. That's it, right? And we're all on the same page. We want to get our students with special needs and special interests in the classroom, right? It's much more conducive to their learning. But we are quite honestly in the middle of a surge. Those numbers just showed that. And I don't know when we're going to get out of that surge. So we're on a slippery slope here. I mean, I know the city of Lynn is waiting to get the sped kids back in right after the February vacation, and some other municipalities doing that as well. So, you know, my vote would be to, again, look at the metrics and look at the data and make sure it's safe. You know, I just texted Dr. Herman again, and his thought was, you know, I'll read you exactly what he said, because, you know, Rick doesn't pull punches. So he had said that there is no good answer. I know it needs much more discussion, but if kids come back, there should be testing in place for those with symptoms. And we don't have that capability yet from the Commonwealth. So, you know, at the end of the day, you know, my vote would be to put a little bit additional pause on it. And, you know, we all have to make sure that it's done in a safe but I also understand what Cynthia and Judy is saying. You know, I'm getting those same calls, you know, at work and on my private phone. So I get it, but we don't have the magic answer. But I can tell you that a municipality on the South Shore today, smaller town, notified parents, because I have a sibling that lives in that town, 25 kids tested positive. And this is a very small school district. So my vote would be to wait a little bit longer. I know some people are going to be really upset by that, but we're eventually going to get kids back in the classroom. That's what we have to do. But it has to be done in a way, in my humble opinion, that's going to be safe. Will it be fully safe? No, because the virus isn't going to be dissipated in the near future. So thank you, Mr. Vice Chairman.
Thank you, Mayor. Mr. Minicello, I see your hand. Do you want to?
Yeah, do we have the numbers or the information about what the other gateway cities are doing? I know you mentioned Lynn, but yeah, what about, you know, Fall River and Boston?
Mike, I think, has that.
Do we
Yes,
have all
so
that?
we had Fall River sent all their kids remote in sending back their special needs children, I believe, right around February 8th. Lynn is waiting. They've been fully remote the entire year. They are sending they're looking for February 22nd, which is the week after the February vacation, to send their students with disabilities back, and then March 1st start to phase in all their other students. That's the same with Worcester. They've been fully remote. They're looking to bring their students with disabilities back the week after vacation, which is again February 22nd, and then bring back their other students starting on March 1st. Chelsea voted, I believe that their numbers are so bad that they have voted to stay remote until further notice. I saw I was on an email from Boston. I think, Cynthia, you can correct me if I'm wrong. I thought it was February 8th, and then they were going to, March 1st was going to start phasing in other students as well. I'm not 100% sure on that.
So currently we are the special education students, the high needs. And then, yeah, I think we're going to start phasing in the ELLs. We were supposed to, I think it's right after the February break. And then March 1st would be everybody else.
What about our surrounding towns? You know, Abington, you know, Easton. What are they doing?
They're all remote. They're all hybrid.
They're hybrid.
Yep.
Okay, so they're coming in some days and home.
Yeah, they're coming in. Usually they come in 2 days, and their students are remote for 3 days.
In Bridgewater, the same thing.
Yes.
All right. I mean, and Boston's going back with special needs in February.
No, we currently are in the phase of the highest needs right now.
So your students are the highest needs kids are back in school?
They are currently, yes. We've been back since before the Christmas break.
Okay. All right. I mean, it's fairly obvious. We've got to get our special needs kids back. I mean, we can't keep them out, you know, until springtime. I mean, so at some point they've got to get back. You know, I would say, you know, February, you know, we've got to come up with a decent plan here, you know, to space them out and at least get the special ed kids, because they're not getting an education. I mean, they're just not. I mean, what they are getting is babysitting as far as I'm concerned, you know, but that's about it. So those kids need to be back at some point. And I get it, there's high risk, but that population is the most at risk for missing out on a whole year's worth of school. And, we've got to, it's not an easy decision. Don't get me wrong. I mean, I'm not taking it lightly. But that population has got to get back at some point. I mean, so it's not a good choice, but it's a choice that obviously other communities are making, and we're not exempt from the rest of the country and the rest of the state. So our population has to get back at some point, and the sooner the better. But we need to come up with a reasonable plan for that group of kids. We're talking about what, 300 and some odd kids, Mike? Is that it?
Each every 2 days. So it'd be 340 2 days and another 340 the other 2 days. So it'd be total 680 students.
Okay.
So it'd be
It's not a good choice, but the choice
it's
is gonna be made.
340 total per hybrid per 2 days.
Okay. Well,
All right.
it's going to have to happen sooner or later. I mean, all the other communities are doing it, and Brockton can't be, the special ed kids of Brockton can't be the only ones in the state that aren't going to go back.
So, Mike, refresh my memory. We were currently, it's Feb 1 for high needs, and then what was the?
It was then February 8th for pre-K to pre-K and K, 6th grade and 9th grade. And then we would look to bring them back. We'd phase them back 1 day a week and then into a 2 day a week. So, students would just get used to being in because we have very large schools, obviously. So we would start with a 25% and then roll into a 2 day a week as we move through March. The students with disabilities that we just spoke about, they would be 2 days a week, and then they would move into a 4 day a week in person.
Okay. And I know a couple of people have put their hand back up to, and I want to ask Cynthia, Boston has had high needs back since, you said, just before Christmas. I mean, I know you don't have hard numbers in front of you, but just, I guess from what you're hearing and seeing, have you had a lot of cases among that population that is currently in school?
So one thing we have that's different is what Mayor Sullivan talked about, right? We don't have the testing in place because we're not getting that from the Commonwealth. So we do have testing in place, like particularly in my school, we get to test every Tuesday. Has there been cases? Yes, there have been cases, but the way that our admin has gone about it is, well, it's different, right? It's a little different than Brockton because not all teachers are in at the same time. So for example, I have a cohort, right? And in my cohort, out of all, there's a total of, so there's a math, science, ELA, history teacher. Out of the 4 teachers that teach that cohort, either 1 or 2 of us will be in per week. Currently in Brockton, we have all our teachers going in at a hybrid model. So that's one difference. And then the other thing is, not all students are going. So the thing that's happening is, because students have the option to go, but there's a lot of parents that prefer their kids to stay remote, you're seeing that students that started coming in, they're no longer coming in because it's not what school they're used to, right? They're used to seeing kids in the hall being able to socialize, but with all the social distancing, masks, school's not the same. But the very few kids that I've seen that I haven't been able to connect with remotely, that's 1, 2, or 3, they have been coming in and getting that one-on-one for me. Mayor's Mike did mention how, it's going to be hard, the live stream, giving a synchronous work, because you do have to teach synchronously, right? So you're teaching kids literally remote, and at the same time, you're teaching them in person. So that gets tricky, and that's pretty hard as an educator. I'm fortunate that I have a para with me. Not all teachers have a para. So that could be very challenging for a teacher who has a class of 30 kids. But when we talk about high needs, most of those students have a para, and we know that pre-K and K, they do have a para as well. But yeah, so then the biggest difference is that the building is not full of all teachers. Teachers are making schedules within the cohort. Okay, I'm going to come in this week. These are the numbers that we have. And according to the numbers we have, those are the number of teachers that come in.
And you said on the testing, they're testing teachers or students or both?
So they're testing both, but with students is more like a pool. So because if they're under 18, they can't really, I guess because of confidentiality reasons. So students do get tested if parents allow it, and if they're 18, they allow it. But I guess it's a little tricky because it's not like their name, it's like a pool of kids.
Mhm.
So that can get messy too.
Yeah, that's what I was curious about. So it sounds like it's voluntary with parental permission. And I asked that because I had checked with Sarah, our attorney, on just that issue, and she advised that they did not think that we could mandate it. And so it seems like Boston kind of found a way to test some of the kids where parents are willing, and kind of worked with that. So we may need to look a little more into that. I mean, well, Cynthia, you had your hand up anyway to comment, so I'll let you continue.
So I think I spoke a lot about the things from you asking me, but one thing I have it's a question towards Mayor Sullivan. So is there any way that, I know we talked a little bit about the Biden administration and maybe there'll be changes there, but is there any way that we could get help from the Commonwealth to get testing in place? I mean, we're one of the biggest districts, and we're one of the most affected cities. Why aren't we getting testing?
They're not mandating municipalities, have their teachers or their staff get tested. But I'm working with our procurement because I think it's appropriate that, as the mayor, and I've already spoken to Mike about this, that we spend the money to get the testing. And if people want to get tested, they can. That would be employees. That would not be the boys and girls students, as we were told by legal counsel. So we're working with procurement now because it's a municipality. We have to procure it out. But there's a cohort that allows municipalities with the school district and with the city side. So we're in the process of doing that right now with Mike Morris from procurement to get testing. But until it's finalized, I'm not going to announce, the whole process. But we're already working on that, Ms. Mendez.
Okay, thank you.
All right. And then I saw Mrs. Sullivan.
Yes, I was just thinking that maybe if there's some way I was directing this towards Mayor Sullivan and Superintendent Thomas, because Dr. Herman does some great slides there. If there's a way, I think it would help the committee members if we had like maybe a slide with the gateway cities and what they're doing. And I don't know if this is even possible. I don't want to put you on the spot, but if the committee members could see what the gateway cities are doing, their numbers, are they back? Are they doing hybrid, remote? If we could somehow get, I don't even know if Dr. Cancel could do something
I could
like
actually
that.
get that for you, Mrs. Sullivan.
Okay,
I
I
mean,
think that would help.
I have Worcester, I have Lynn, I have New Bedford
Chelsea,
in Fall River, Chelsea, I have
Chelsea, Worcester,
Worcester, I have Worcester's staying remote until after the vacation.
and like
Chelsea
kind of
is
like
remote until further notice. Springfield, I'll have to find out for you.
would
A
we be
New
able to get their
Bedford is-
numbers?
What's that?
Would we be able to get like their numbers
You mean
of
the-
how much in the red they are?
Yeah,
or
of course. Yep. I think
Okay.
I think we can get that from Dr. Herman.
Boston too, and
Their numbers. Yep.
Yep.
And New Bedford is hybrid. Fall River is hybrid except for their high needs. They were in and then they pulled back some. Again, Chelsea's remote until further notice. Lynn is remote until after the vacation, and Worcester is remote until after the vacation. I'd have to get you Springfield, and Lawrence and Low. I want to say Lawrence is still remote, but I can check on Lawrence and Low tomorrow. And Cynthia just gave us the Boston.
right. For Cynthia, did Boston already start though, and then they stopped? Is that what happened with Boston? Superintendent Thomas might know too.
Yeah, in
I
the
know-
fall we started and then we had to stop, but then we started up again before the Christmas break.
Okay.
Currently still.
Just high needs.
As of now, yeah.
Okay, thank you. Thank you, Superintendent Thomas, too.
No problem.
Mayor Sullivan. Yep.
All right. Okay. Ms. Asak, I think I see you up again.
Thank you. Actually, Mrs. Sullivan had addressed one of my questions. Was I know we've asked where the numbers, and sometimes people say, why do we care what's going on in the surrounding towns? But I think that helps us understand how those schools are able to get through with their hybrid, as far as what's going on with the schools. But my thing is we're a large district. We're over 15,000 students, and that doesn't include our staff, our educators. We're a pretty large district. How do we compare to other districts as large? As far as I'm not sure how big Lawrence is and in those surrounding towns, but aren't we pretty? Isn't our number as far as a large district, Superintendent?
Yeah,
How do we
so
compare to
Boston-
other schools?
Boston's one, yeah, and you know what they have done. Second is Springfield. I'll find that out for you. Third is Worcester.
Okay.
And then we are fourth, and right behind us, probably with only about 200 less students, is Lynn. And I think it's followed by Lawrence and Lowell.
But as far as the
we're
district,
still fourth, barely fourth. Lynn is right behind us. And I'll get you, again, I have to get you information about Lawrence and Lowell as well.
yeah, because a lot of people are comparing us to Boston. We're Brockton. Boston's a lot larger than Brockton. And to me, it's all about safety. I know we have to get our students back in the classrooms. I feel bad for our seniors this year. They missed out on their junior year and their senior year, where, you have your special needs students that are trying to adapt to home remote learning. And you have your youngest students trying to learn remotely. I completely understand. I want to make sure it's safe before we have another surge. I don't want to just make a plan and all of a sudden we go back to school and then that's it. We got to go back to remote. So I'm pushing for some kind of stability for our families and to keep our families and our staff safe. I think a 2-week delay is not asking much. It brings us into, what is it, the end of February? Because right now we were talking about early February. I think that just brings us further into February as far as waiting to make a decision. Our numbers, and I agree with Dr. Herman, our numbers are really high at this point. But I'm only one vote, but I just want to make sure that my colleagues know where I stand. I think it's too soon. And I know we have a lot of families that do want their children to go back, and I understand that difficult part of it, but the majority of the families in my ward would feel more comfortable if their kids could stay remote. And if they have the choice to stay remote, if they also have the choice to stay with their teacher, I think would make that decision a lot easier than knowing if they stayed remote, they might lose the current teacher that their child is with. I think that would help a lot of families make a tough decision. But that's just my 2 cents. But thank you. If we can just find out the other districts, because I think there's a lot going on that they're not reporting to us. There's no way. I mean, the way the numbers are, I'm sure they have more kids that are testing positive.
Yeah. So I'm almost, and I'm curious the committee's thoughts on this. I'm almost thinking we need to maybe, let me ask you, how long, do you need, all right, let me start with Mike. Do you need a vote on this evening?
I mean, we would need one this week. I just think families need to know if we're gonna.
We don't vote tonight, then we've got.
I think families really need to know an update on. And again, I have gotten emails from parents of special ed students, and I hear what Mr. Minicello is saying. I still watched the video that he sent me of that the special needs child struggling at home, crying, and I watch it often. And then I had a parent, I appreciate the email, and just wanted me to come out and admit that we weren't going to have kids ever come back to school this year. And this is a parent of a special needs child, and I understand fully what they're saying. I just think, I think we need to set a date. I would recommend that we go no later than after the vacation. So right now, it's February 2nd would be when we had high need students come back. You know, if we are going to delay, if that's, you know, then I would recommend no later than that Tuesday after the vacation would really need to be the date those high need students need to come back to school. And I hear what Ms. Sullivan is saying, and Mrs. Mendez and Mr. Rodriguez and Mr. Menicello, that we do need a date for those students. And I don't think there can be any, if we do delay tonight, there can be no further delay for those students. We do have to have alternative plans for a high school, obviously, that has 4,200 students. That's why we were looking at starting there with a smaller cohorts of 25% and starting all of the students at a 25% back in March. So it's very small numbers coming in. So we do get a handle on it. We do get a handle if there are positive cases. It does give us a little bit more time. Hopefully that teachers we moved up in getting the vaccination. We could be getting good news within the next 2 weeks that hopefully teachers will start getting vaccinated sometime early February. I mean, that's my hope. But if we do delay, I don't see a way for us going beyond that beyond that Tuesday after the vacation for those 640 high need students. Again, 300, 680, 340 each cohort. I just don't think that we could go much beyond that, because those students really do need in person, and they would start at 2 days and then switch to 4 days. Right now, again, they're scheduled to start on February 2nd, and then they would be in for 2 weeks, and then they would, obviously there'd be a vacation. So my recommendation would be, if we are going to delay, it would be delay 2 weeks, and then we have to we have to assure these parents of these special needs students that, these kids are coming back. And I don't think would be able to delay beyond February 22nd. And then I think we need to give the other parents assurance of all other students that they're coming back as well. Because I think, it's getting to the point, right? We're getting late in the year. And we've done this again. We've done it safely. That's why we're in a tough situation, because we've looked at the numbers all the way through. And we've made really good decisions based on health and safety of everyone, knowing that, students may not they might not get it as often and get as sick, but they do carry it, and they do live with older adults and grandparents. So we have taken safety number one. So it's hard for us to say, for me to say, okay, then it's a good idea to bring them all back at the highest number we've had. This is the highest rate that we're in the red deeper than we've ever been. So we have to consider that as well. But I just think that if we do delay, I think that week after vacation really has to be the date that we are bringing back our high needs student, because I hear those parents with special needs students, and a lot of them think we're never bringing students back, and that cannot be the case. They have to come back. And again, I continue to watch the video every once in a while that Mr. Minicello sent me, and it's moving as to the point where those children have to come back to school. So if we do delay, I think you delay 2 weeks because there's a vacation there, and then right after the vacation would be high need students first, and then phasing the other students in. I'd like to give us more time, but I really think parents need time to plan, and as February 1st being the date for those students and February 8th and now the dates, I just think they need a little bit more time.
Can we, the other thought I had, if I don't know what the committee's thoughts would be, let's take this as two separate issues, right? We have another week on pre-K, K, 6, 9, Right, they're not till the 8th, so I think we could, Superintendent, we could probably push that till we have a full school committee meeting next Tuesday, I believe, correct? Yes. So we could push that group of students, the vote on that group of students off another week, get the data that Judy, that you were looking for, maybe I don't know if our Friday packet would be reasonable, but maybe before that meeting. If we could get it for Friday, that'd be wonderful, because it would give.
I'll have it by no later than Thursday.
All right, even better. And maybe we take up the issue of the special education date tonight, and then we'll hold off a week, because and I'm torn myself. It's a small group of kids spread across the district. So, versus bringing a larger group of hundreds of kids back. And I am, like everybody, really concerned about, how far back this group of students is being set back. And I'm sure they're not going to bounce back the same way. I guess at this point, we've talked about a 2-week delay. We've talked about, there's a 1-week delay. We would, does anybody want to make a motion of any kind? We got to do something. Well, we don't have to. If we do nothing, I guess it's February 1. Is that? Anybody, are we leaving it at February 1? Is anybody going to motion for a different date? Mr. Minicello?
So Superintendent Thomas, your recommendation with regard to the special ed high needs student would be for February after, the February date after vacation?
Yeah, and that would be the date.
And what February, and what would be the exact date?
That would be the date of the Monday, or actually Monday, everybody, with the 23rd. It would be Tuesday, the 23rd.
And is that your best recommendation at this time, or would you
At this
recommend?
time, just so we can guarantee them, not guarantee, because it's hard to say guarantee, but I think we can say that is the date the high needs students are starting.
Okay, then I would make that motion then for February 23rd for the high needs special ed students to return back to school, and obviously have in place, the best and safest plan for spacing for the safety of our students, staff, and teachers that we can do, and obviously model it after best practices that are going on throughout the Commonwealth with regard to other districts, urban and otherwise, who are taking part in this sort of, in basically this in-house teaching of this population that are at risk here. So that's my motion.
Now I would like
Second.
to second it.
Okay, we have a motion on the floor to delay high needs until the 23rd, properly second. I got that right, the 23rd?
Yes.
Properly seconded by Mrs. Mendez.
Can I put on the record though, with the hopes of getting testing in place soon though? Part of that, I know Mayor Sullivan discussed him working hard on that, but that would be the best to have that in place when our students are in the.
Yeah, I'm sorry, and I'll tailor my motion to, in that motion, seeking all available opportunities to have in-house testing for the Brockton Public Schools.
With the caveat, though, it would not be for the students, and it would be only optional for employees, much like the fire department is trying to, it's optional. We can't mandate it, or be grieved under collective bargaining.
Any other comment on the motion? Any other discussion on the motion? Okay, seeing none. We have a motion by Mr. Minicello, seconded by Mrs. Mendez. I'm going to call the roll. Mayor Sullivan,
Yes.
Vice Chair D'Agostino, yes. Ms. Asak,
Yes.
Mrs. Mendez,
Yes.
Mr. Minicello,
Well, seeing I made the motion, yes.
be a little weird if you voted against yourself. Mr. Rodriguez,
Yes.
Mrs. Sullivan,
Yes.
Mr. Sullivan,
Yes.
Motion carries unanimous. Our high needs population is now targeted to return the 23rd. And I would agree with the superintendent. We really need to just do that on that date. I mean, barring, hopefully the new administration gets in and vaccine is rolling out and some things really start to happen. But again, I think we got to stop delaying, especially that population, but also even everybody else too. I mean, if we go back for March 1, we still got 4 months in person with with the kids. You still can do something with that. But if you get into May and you got a month or 2 months, I don't know. Anyway, all right. Thank you all. I know that was a obviously difficult decision and difficult discussion, and I really do appreciate all the thoughtful comment and discussion on that. We'll move on to item number 3, cohorts. Superintendent Thomas, do you want to?
Sure. I'm actually going to have Ethan jump in, and he's been doing this hard work with our principals and with our tech department and with other people he works closely with, IT specialists. We have a plan for 2 cohorts. We also have a plan, the plan for high needs students returning, they would be in 2 cohorts because they would start 2 days a week and then they would roll into 4 days a week in person. And then we also have a plan for all other students at a 25% start, which is 4 cohorts. And that way, obviously we can control spacing, control getting students used to being in school, getting students used to passing in the hallways, getting them used to, eating in the cafeteria again. The arrival dismissal process at our schools would be able to just, be planned out and much better and get our parents and students used to being back. And then we would switch to obviously from a 4 cohort to a 2. And Ethan has done a lot of work with that over the last several weeks. So I'll let him jump in and explain that process.
All right. Good evening, everyone. I wanted to, as Mike said, just tell you a little bit about how we're thinking about the cohorts. Trying to operationalize the idea that Mike suggested last week, which was to have, for safety, to have students come in 1 day a week instead of 2 to start the hybrid. So we would have on Monday, all students remain remote. On Tuesday, the orange 1 cohort would come in. On Wednesday, the green 1 cohort would come in. On Thursday, the orange 2 cohort would come in. And on Friday, the green 2 cohort would come in. And so when we're able to do this, we would, the orange 1 and the orange 2 eventually would just become orange, and the green 1 and the green 2 would just become green. So that's the story. Obviously, this is very complicated because you want to try to keep all of the siblings together and families. It's not easy to do that, but we've tried to do that. And now we have the individual schools. We've given them tools and shown how to check their numbers to see if the cohorts are balanced, but especially as you get into the class level, you could have a split that just doesn't make sense. You could have a split of, you have 2 kids on in the orange 1, and you could have 12 kids in the orange 2. And, that can happen. We haven't seen many instances, but the schools right now are trying to balance those out as best as possible. In terms of there's a little caveat here. The special needs, the high needs students, those students would follow a slightly different pattern. They would be going in to start with 2 days a week. So they're in a separate cohort. And then when they're able to, they will go 4 days a week. So we split everyone up. We have a great group of volunteers to help support the people in the schools. We have transportation and Peggy Calais involved because obviously, you know, depending on who's showing up, you have a different transportation route. So it's a lot of moving parts, but we are working very hard to make sure that this happens.
Any questions for Ethan? Thank you, Ethan. So it's just important to know when we do have cohorts come back, our goal is, and this is a non-negotiable, that obviously families would be kept together and coming to school on the same day. But I also want to make a point that we cannot make exceptions. We just would not, it would be impossible to take special requests that, you know, somebody that might live on the same street or in the same neighborhood or is friends with somebody. There's just no possible way we could ever take those kind of requests and change the cohorts. There's just no way that could be done. So the only thing we guarantee and is to make sure that families are together, siblings are together and going to school on the same day. But there's no way we could ever entertain other requests because, you know, somebody lives on the same street or, their friends go to school together. It's just impossible to be able to manage that kind of a situation. So just to let the committee know, because I'm sure those requests be made and we appreciate parents with all the, that all they've gone through and what they've had to do over the last almost a year. It just would be for 16,000 students, it could not be manageable to be able to change cohorts. All we can guarantee is the families to stay together, but to entertain other requests for changing of cohorts would be next to impossible to manage that. It would actually be impossible to manage, but not next to impossible. It would be impossible to manage those kind of requests.
And I do want to underscore, that the superintendent has made it abundantly clear in the way that he can speak directly. We're absolutely committed to keeping the siblings together. Is it theoretically possible that there's been a mistake and there's a senior over at Brockton High who is an orange 1 and there's, a sibling over in kindergarten who's a green 2? It's theoretically possible. We can make those changes. We're hoping that those are exceedingly rare. But, people will need to just understand, as Mike said, with 16,000 or so students, this is a very movable target, and you have, families with different names. You have a lot of different things going on. We try our very best, but there could be mistakes, and we're all going to have to be flexible. And we do expect that, we have the ability to change people. So we will, but as the superintendent said, the commitment is to keep siblings together. Other than that, it is what it is for now.
All right. Well, I mean, we know everybody, the district will do the best we can to accommodate people as best we can. But yeah, we're not going to be able to keep everybody happy and make every accommodation on this. There's just, the numbers aren't really on our side on that one. So well, thank you, Ethan and Mike. Any questions from the members of the committee on this? Mike, Ethan, did you have anything else on that, or are we okay? All right, if there's no question or comment from the committee, we can move on to modifications to electronic device policy in the student handbook. And who do we have that's gonna?
We have principal of the Champion High School and the FDA. We have Cynthia Burns with us here tonight to talk about her recommendation.
Love the background.
I'm out in the traffic. Good evening, everyone. Yeah, I'm here tonight to request to modify our electronic device policy at both Frederick Douglass and Champion. The policies for both schools are currently that all students turn in their cell phone when they arrive in the building and they are handed it back when they leave. And the other part that I would like to modify is that no student is allowed to have an electronic device in the building at any time. Obviously during this pandemic with remote learning, those policies are pretty much obsolete at this point. We want students to have electronic devices. We've done a lot district-wide and in our school to train the teachers to use this as a professional device, and we've also trained the students to use it. So we really feel at this point that that device policy is not serving us very well, and we need to eliminate that. We did survey the staff, and the staff were in agreement with that. The cell phone policy, also creates bottlenecks in the morning where students are turning it in, and creates bottlenecks in the afternoon when they're getting it back. So for safety reasons, we really feel that that policy creates needless groupings of students that, that's not really socially distant. And also, cell phones now are computing devices, and they are opportunities in classrooms for teachers to use those as instructional tools. So given those two facts, we really thought that the time had come to, suspend that for the duration of the pandemic, with an eye to gathering data on how that goes, when students are returned, with an eye to maybe eliminating that for good, moving forward. But we would want to take a look at the data and how that works moving forward. So that would be our request for now. I think we had the support of most of the faculty for that. So I think the students would be unanimous in their desire to have that cell phone policy changed.
So you want to strike those policies altogether and allow, so students would be able to carry their cell phones with them in school?
Right. So for the cell phones, students would be able to carry them with them at school. They would need to be powered off and away unless they were using it in class under the supervision of a teacher or another staff member in the classroom. We don't want students, obviously we want to talk with students about, the importance of not having it during any standardized testing going on, not using it to make recordings that aren't, allowed in school or anything like that. But, we also felt that it was time for students to learn to use that responsibly. So rather than having it become a disciplinary issue, it makes more sense to teach digital literacy and have students learn how to use that appropriately in all manner of settings, academic, educational, even out in the community. So yeah, we were looking to change that. And then in terms of laptops, students are going to be bringing laptops that the district has given them in, even when they are in person, there'll be, needs to use those. So it didn't make any sense to have that policy anymore. It really would seem backward to say, okay, kids learn how to use all these technological platforms, but when you come to school, you can't have it. So, it didn't make any sense. So we really want to, modify that.
Yeah, certainly a carve out for district issued devices would make sense for sure. Because you're right, that's a contradiction.
Right, right.
Here's a device, use it. By the way, no devices.
Right.
All right, members of the committee, any thoughts, comments? Anybody? Nothing? It's been a long night. I think they're all
I can
spent.
tell. But I think, said parents like the cell phone policy as it is, but they also, I think, realize that, students are using it for other reasons other than keeping into, other mischief. But we do have a plan in place to, really work with the students when they come back on being good digital citizens. So that we have some lesson plans around that for students when they return. So I think with those things in place, I think we'll be able to, make that change and really have it be positive for the students and really have it used as an academic tool, and stress that, just because we're in a pandemic doesn't mean that, using a computer is going to be gone when we're on the other side of that. We want the teachers to get that message. We want the students to get that message. These are 21st century skills that our students are going to need regardless of their post-high school plans. So we're doing them a disservice by holding them back. So.
Do we know, and I don't know off the top of my head, I apologize, maybe Cliff can jump in, at BHS, what's the rule on cell phones?
Cell phones are not supposed to be out during an academic period. They are allowed either in a DA if they don't have any work, or in like the cafeteria, but they're not supposed to be on or visible during any kind of instruction or class time.
Okay. I wonder if maybe we can take, and Principal Burns, tell me if this would suit your need, if we took the high school language and just applied it to FDA and Champion, and really probably maybe should edit all of the, when we get to the handbooks this year, that part of the year where we start to edit them overall. I think we probably need to put a carve out in for district issued devices everywhere.
Right. Yeah, no, I would agree. Yeah, that would be fine. I mean, we could take that high school language and apply it. I think some of the programs our teachers are using actually require students to do like polls with their phone. So it's almost like they have two devices. They can do the platform on their laptop while answering the poll on their handheld device. So that would be the type of thing. I think the high school had that carve out anyway, that if you wanted, if a teacher wanted to allow the device to be used, that it could be used in class.
Right,
Unless I'm sure.
it's used sometimes
Yeah.
as an instructional tool, and some teachers may allow it if they feel
Mm-hmm.
there's information that the students could access, but it's with permission. It's not,
Right.
it's not supposed to be out unless it's directed.
Yep. Yeah, that would be fine. We could just take that language and, it was originally designed for the FDA program. And then when the two schools merged together, it didn't make sense to have one group of kids entering through one door with one set of rules and another group of students coming in through a separate door with a different rule. So the entire school kind of went to that policy. But I really, like I said, with the current state of technology, it makes more sense to train kids to use all devices in a proper way than to try to be restrictive with a tool anyway. And then it ends up being a discipline issue, which it doesn't need to be.
Right. And we've talked plenty in other meetings about how, I think Mr. Minicello put it best, right? This is the new pencil and paper.
Right. Yeah.
Which we forbid them to use in our handbook. And now that we're one-to-one, it's going to be even more important. I'm just pulling up online and I'm trying to get to the part of the Brockton High School student handbook that addresses it so I can see the exact wording. Unless somebody happens to know the handbook a little bit better and can tell me exactly where it is.
I'm sorry, I don't know the high school one.
All right. Why don't we do this? I mean, I assume you don't need an actual vote on this evening because they're still remote anyway.
They're remote anyway. I think, certainly I think that language with district issued devices would be appropriate, rather than, other types of things, which could be anything electronic. I did, in the proposed language that I did make a cutout for, absolutely no use during standardized testing, MCAS, any type of testing situation. So, pretty much mirrored what the high school had anyway. So I think that would be appropriate, and we can definitely, I don't need a vote tonight, but I did want to bring it up, as we plan with our teachers. So I let the teachers know, that they need to kind of make some adjustments to how they're teaching, knowing that kids are going to have these devices with them. It changes our check-in and our checkout policy in the morning. Students were, checked in the morning coming in, their bags are searched and they, are gone through over with a handheld metal detector. That's also a policy that I feel, given the fact that we're trying to keep socially distanced, it's not something we want teachers, getting close to students or checking their personal belongings like that. So, it's another consideration to the policy.
Right. We may have to make some kind of a addendum once we get back.
Right.
All right. So, I mean, my thinking, and anybody else in the committee want to jump in, please do. But my thinking on this is maybe, between now and our next policy meeting, since we have the time, between now and our next policy meeting, maybe Principal Burns and the superintendent and I can, we can work on just putting something together, basically take the high school language, but, kind of put something together with that carve out to send to the committee. It doesn't have to be anything fancy, but we could work between now and then to get something out for everybody to look at, review, and put to a vote. Does that sound like a good plan to everyone?
Yeah, Mr. Vice Chairman, I would just ask that either Attorney Mello, Bresnahan, or Spotify just look at it, just to make sure that everything's dotting the i's. That's my lawyer hat. That's not my mayor hat. Just so we can make sure everything's done right. So I support it, and thank you, Ms. Burns, for what you do at the high school.
Thank you. Appreciate it.
That makes sense, Mayor. It'll take them 2 seconds and potentially avoid us, prevent us from having a lot of headaches. So, all right, Ms. Zasak.
Thank you. I just want to say thank you, Principal Burns. I agree. We should be across the board. Everyone should have pretty much the same rules, and it just makes more sense. Have all our students follow the same when it comes to that. So thank you, Mr. D'Agostino. I definitely support that. Thank you.
Appreciate it.
Okay. All right. Well, thank you very much for joining us and bringing this issue to us. Like I said, we'll get something together for a vote at the next policy meeting. And
Thank
get
you.
that done for you. Thank
Appreciate
you.
your time.
Any other comment on this issue? All right. Seeing none, I'm going to jump to other business. Does any member of the committee or the superintendent or the mayor or anybody have any other business to bring before the policy subcommittee this evening?
No, I'll just, express to the members that I'll work with the superintendent, continue to work with Mike to do a deep dive on what other municipalities. He'll be reaching out to superintendents. I'll reach out to mayors. That way, we have a document that really compares and contrasts, and great suggestion, and it's going to be very helpful. So thank you, everybody.
All right. Oh, superintendent, go ahead.
I want to thank the committee for all the thought you put into about the return of students and the safety of students and staff. It's always been number one, and you've been doing this since last March. But you also know the importance of getting our high need students back into school. And I'm glad that, we do have a date for them. And it's also important to know, and again, we talk, it's important to talk about our high need students, but all students at some point getting back to school, for our seniors to have a part of their senior year to be able to be back in school. And I'm really hoping that as we get through the end of this month and into February, that we really have some clear guidance on where they're going with the vaccine, especially for school personnel. And as we get into after February vacation and into March, again, it's important for all our students to come back to school, and it's got to be done in a safe manner. And again, I appreciate the mayor's efforts to do testing, but we do need to hopefully have our seniors have some of those things that all seniors hold dear. We know what our seniors lost last year, and we knew how much work we put in to making sure they had an in-person graduation last year. And I think we know how important it is for seniors and juniors, every student to get back into school. But I appreciate you always taking safety of the students and staff and their families as a top priority. And I appreciate again how much effort, how much conversation you put into this tonight.
All right. Yeah, I agree. This was certainly a lengthy meeting with a lot of discussion and an important topic that deserved the time that it was given. So I really appreciate everybody, giving it the very in-depth consideration that we gave it. Obviously, it's again, there's no easy decisions here. It was, but you guys put a lot of thoughtful discussion into the meeting tonight, and I really appreciate it, and I appreciate the 2 hours that you've given, because most of this went to that topic, and it really is important. So I do appreciate, like I said, everybody's thoughtful discussion and all your input, and we work as a team, and tonight I think was a good example of coming together and having some debate, and then but also working as a team to get the right things done for our students. So with that, if there's nothing else.
So D'Agostino, I just wanted to, again, tomorrow being inauguration day, I know there's some calls to my office today. Some people are concerned about the city and the safety of the citizens. I just want everybody to rest assured that we are taking every precaution. The city of Brockton will be safe tomorrow and going forward. And I do want to thank the police chief, the fire chief, Steve Hook from Beamer, and Mike Thomas, and the school police, Frank Vidaro, who leads that. So again, if anybody's watching this, any parent, any student, anybody at all, please know that the city of Brockton is safe and will continue to be safe for everybody that lives and works here in the City of Champions. Thank you.
No problem. Thank you, Mayor. Ms. Asak, did you have your hand up?
I did, actually. I just had a quick question for Superintendent Thomas. This is a little off topic, but a few families have received notification from Comcast that they've met their data as far as their data usage. Do we still have MiFi devices for some of the families that are running into that issue as
Yep.
far as using up their data? Okay,
Yeah,
so,
if they can call they can call the Parent Information Center. Ethan, who else could they call? Is he still? I don't know if Ethan's still with us.
Mike, this is June. I'm sorry.
June,
They can
thank you.
call, they can call the Title I office. They can call and talk to Karen McCarthy. I know she's been in touch with Comcast, and that the Comcast service has been extended, I want to say until June. But I'll double check the date with Karen.
okay,
do you
and the
have-
MiFi,
do
I
we have that?
apologize, the your turn.
For
The
MiFi
MiFi
too.
is parent, right?
Parent
Okay,
Information Center for MiFi. Actually, what we can do is I'll have Jess tomorrow text out those phone numbers.
Okay, that
So
would
parents
help, because
get
I know there were a
information.
lot of parents were upset about that. And they're not, I guess they were aware of the MiFis, but just didn't realize how the MiFi worked, as far as you can have multiple devices on it, and it does have the internet for you. Especially if you have parents that are working from home, that will help as far as their usage. And it's free of charge just to BPS students. So I just want to make sure we still had some before I put the word out. So
We do, and it's really important that that you do let us know if people are experiencing difficulties. So as June said, the Title I office, the Parent Information Center, and just if nothing else, reach out to me or to Dan Vigent. We really want to get people, or Kevin DuPont, we want to get people connected. So reach out.
thank you, Ethan. That definitely helps, especially where so many families have maxed out their data usage. So I'm not sure what's going on with Comcast, but that will give our families a little bit of a reassurance that they do have internet service free of charge. They just have to sign out the MiFis. And do they have to return those at the end of the school year?
At
They
the end
do.
of the
Okay.
year, yep.
So they do return them at the end of the school year, but it's unlimited internet for the students. Okay, perfect. Thank you so much.
I should add, it's not, go and play video games all night, because that will use up your data. This is, for a connection to do your schoolwork. That's really what it's geared for. So you might be disappointed with the gaming performance.
Okay, thank you.
And then finally, I just want to say again, again, I appreciate your conversation, and I appreciate again the need, obviously, for us to get students back in school. But I would be remiss if I didn't again commend the teachers and administrators, our paraprofessionals, our MTAs across the district for the work they've done with remote learning. Again, we've been recognized for a district that is in full remote, doing the most live streaming in the top 5 in the state. And that's a lot of work. And that's with all students. That's with students with disabilities, students with high needs, every student that attends Brockton. And we know it doesn't work for every student. We absolutely, that there's no question that it doesn't work for all students, but the effort that the teachers, the administrators, again, and the support staff have put in to making this as successful as possible in a very tough situation has been amazing. And I just want to thank them all again before we end tonight. And then thanks obviously always to our food service workers for continuing to serve meals every day and continuing to do it during the winter months. They're out there giving out the lunches. So we appreciate all that they do. And obviously the role the school nurses played in giving out the vaccines, helping to give out the vaccines at the high school, and what they continue to do. And again, all our staff that are helping students getting through a lot of difficult times, our counselors, our adjustment counselors, and again, and the custodians for continuing to work hard to make sure the buildings are clean and safe. So I just wanted to end the night on that. I know it's been a long night, but I just wanted to make sure that those people are recognized for the very hard work that they're doing.
All right. Yeah. Hey, we appreciate everybody's hard work for sure. All right. Anything else? Miss Asek, did you have something else?
I do apologize. We need to schedule a facilities meeting.
Right. I would say, because not everybody on this is on facilities, maybe would you want to contact Melinda tomorrow and work with her to get that scheduled?
Sounds good. Thank you so
All right.
much.
Thank you, Ms. Asak. Okay, if there's nothing else, then I'll entertain a motion to adjourn.
Motion to adjourn.
Second.
Motion to adjourn by Mrs. Sullivan, properly seconded by Mrs. Mendez. I will call the roll. Mayor Sullivan,
Yes.
Vice Chair D'Agostino, yes. Ms. Asak,
Yes.
Mrs. Mendez,
Yes.
Mr. Minicello,
Yes.
Mr. Rodriguez,
Yes.
Mrs. Sullivan,
Yes.
Mr. Sullivan.
Yes.
We are adjourned. Thank you all very much for all your time tonight.
Have a good night,
Thank you.
everybody. Be safe.
You too.